Do you think people actually realize that the medications they take actually affect their sexual and reproductive health?
Medications affect our sexual health. Most of the drugs that tamper with our sexual life is that it either inhibits something like hormones. So once there is excessive removal of sodium, sometimes magnesium, sometimes potassium from the body, what happens is that there will be reduced neural sensation.
When people start to abuse postino, or when they start to use, they're more likely going to use. I don't know, maybe it's because it gives them a false sense of safety. So does it inhibit their function? Does it decrease their sexual function?
When you are taking hormonal contraceptive, what you want to do is to prevent ovulation. Once you take hormonal contraceptive, it is initiated. It inhibits hormone we call testosterone. Testosterone is the key player in most of this sexual arousal stuff. Anything that has to be sensations, libido, testosterone has to come in, both in male and in female.
Aside from alcohol, what other medication can, affect people's sexual function, especially negatively or positively?
There are lots of medications, but
Hello, welcome to another episode of the Intimate Matters podcast, your go-to podcast as it pertains to sexual and reproductive health. And we're glad to have you over the season. In this season, we've spoken about a whole lot of stuff bordering on the physical, the psychological, and sometimes we even spice it up a little bit with the spiritual aspect of sexual and reproductive health and how it concerns us, how the government play into it, how the community play into it, how we as individuals also influence our sexual and reproductive health. And for today, we want to talk about an aspect that oftentimes people overlook. So sometimes, if you look through so many of the sessions we have when we're talking about majorly sexual dysfunction, we talk about the fact that medications or sometimes underlying disease condition can be something that affects our sexual health. And today, we want to look at how medication and hormones affect our sexual health. Yes, we know there is a whole lot of throwing hormonal imbalance around. A little thing that someone is having issues, we hear hormonal imbalance. But today, we really want to get into the nitty-gritty of how it affects our sexual and reproductive health. And I have an awesome young man here, a pharmacist, Elijah Etefia. Thank you for joining us today.
It's a pleasure. Thank you very much, brother.
So we know you do the drugs, and you've. If I say you do drugs, it may look like say you did. You do medication.
Yes, medication.
You do medication, and you see really how it plays into it. So I'm going to start with the basis of what we find in our community. It seems that whether it's out of ignorance or people just want to ignore it. From your experience with interacting with clients, do you think people actually realize that the medications they take, either for a disease condition they have or for whatsoever reason, actually affect their sexual and reproductive health?
Okay, the truth of the matter is that to start with, looking at sex is actually controlled by, shall I say, 5 key things.
Okay.
The first is the brain.
Okay.
We have hormones. We have the nerves. Our nerves affect our sexual life. Blood flow and even our emotions. So basically, let's say 5 key things affect our sexual life. And they are kind of different if you look at the pathway of how this thing happens. So talking about drugs, for medications to be produced, they're not just produced from isolation. We have to look at, okay, where is this drug going to act? Okay. Most of the drugs that tamper with our sexual life is that it either inhibits something like hormones or some let's say neurotransmitters or something closer to that. So in a nutshell, I would say that medications, some though, not all, affect our sexual health. From those key things I said, the brain, that there are a lot of drugs that can always pass through the brain.
Sometimes it's a highness or a lowness.
Even like alcohol, we know that definitely alcohol can affect. It either inhibits or even improves our sexual life, but depending on how you use it. So medications sometimes, or most times, there are those that are over the years with research have shown that drugs affect sexual life.
Okay, so because you mentioned like 5 key things, and now that I'm looking back at it, when we are in the act itself, like when we're like on the process, it doesn't look like it happens so fast. I see a woman, my thing stand. it happens so fast that for you to tell me that the brain has to come in, the blood flow has to come in, the nerves, the emotions, it just happens so fast, and sometimes it really look like it's a very straightforward process. Nothing really happens. But now you mentioned alcohol, and I want us to talk about that a bit. Is it possible that one thing, let's use the context of alcohol, can affect two individuals differently? Now, because I had a friend, I had two of my female friends, and from what I've seen and also what they've told me, it seems like all affect them differently. So there's one that drinks, for example, and maybe gets tipsy and it's all honey and wants to be with a man. There's another that drinks, gets tipsy, and it's like she just doesn't feel the urge for it. That's what they told me. So is it possible that one thing, like alcohol, for example, can affect two people differently?
Yeah, definitely. As I mentioned earlier on, talk about alcohol. Alcohol, if you look at it, it's acts centrally. Yes. Though at some point you can look at maybe the kidney, it also has a way to affect the kidney, but within the brain, it has lots of activity there. I don't know if you actually discover that when some people drink alcohol, they tend to sleep, tend to doze off. Yes. But in terms of sexual life, what alcohol does is that it gives you this euphoria, this false paradise. This pleasure, it will be there. Lots of women, especially in women, they always have that feelings. Once they take it, especially those who are just new to the stuff, because at first, your body's trying to, adapt to it. I just took this alcohol and that delusion. When you are high, in terms of high,
feel like
there are a lot of things that happen.
Okay.
You have the sexual urge will be risen. A lot of things will happen. You have the urge. I feel like having sex. I feel like lots of things will happen. But over time, it's what we call deregulation. Understand? Your body won't respond to it any longer that way if you take it over time. That is why let's say someone can take alcohol or let's say 50 to 100 units of alcohol without being moved. But just take 2 units.
And add on top of the 100.
You are done for.
So by 100, you were not moved. By 102, you've already
Thank you very
become
much.
a
You
gunner.
understand? But someone just take 2 units and the person is off going. So that simply shows that alcohol, because it acts centrally, and I said the brain, it has a way of, manipulating the brain, thereby initiating that signal that tells you, I am aroused. And looking at sexual life, basically, there are 3 responses we have.
Okay.
The sexual cycle response. The first is just the libido, the desire to have sex.
Okay.
As we actually mentioned, I have the desire to have this sex. And that one is arousal. After a desire, as you've said, you've seen a woman, you just think, I want to have sex.
You see the shima, the past, just be like,
so
okay.
Let's say your crush kind of just came to your mind, I want to have sex. Lo and behold, she just comes in. There's no how you'll be aroused.
Okay, so after the libido comes the arousal stage.
Arousal.
Okay.
Then the next one is the orgasm. That means in the course of...
It be like that. It be like that cycle, no, they complete though, because don't be everybody there. Not everybody they move from libido to arousal to.
Yes, especially in women. The way women are wired sometimes, like some women, they think happens the libido self. They might not even have the feelings.
Okay.
The arousal. The signs of arousal is like that wetness, lubrication. They won't be wet at first. But in the course of the intimacy, that is when they are like, I desire more. And that is when you lead to orgasm. But first, looking at it, it takes these traditional steps. Libido, that is a desire. You have the arousal, then orgasm comes in. And that before orgasm comes, it has to be very intense. Lots of chemical neurotransmitter, dopamine, they actually come in. So
Yeah, women. So that could possibly be some of the reasons why it seems harder for women to attain orgasm, because it seems like their threshold is a little bit higher.
It's higher, my brother.
Our one is just small
That's
like
very intense.
Small like this, where you just do everything, everywhere on board. But for woman on, you have to, take it up and build it. Okay, so you've mentioned alcohol already, but aside from alcohol, what other medication can, affect people's sexual function, especially negatively or positively? Because I know some of the substances might up it a bit, some might lower it. So what other medication or substances can affect?
Okay, there are lots of medications, but they are not that common. We look at first antidepressants. Those are like the key, the number one, the most common.
Okay.
In research time, we've actually seen that antidepressants is at the top,
Okay, in terms
responsible
of,
for in
is
terms
it, does
of
it inhibit
what
or
causes
enhance?
that inhibits
Okay, sexual function.
sexual functions.
Okay.
Antidepressants. Then look at antipsychotics. I will tell you how it does that
Okay.
maybe later. Look at antipsychotics. Those are drugs meant for, let's say
Psychosis.
mania, mental disorders. Then we have some BP medications, mostly beta blockers and diuretics. And example, the thiazide diuretics. Those are those ones that are really, 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 really involved in this. Then we have likes of hormonal contraceptions or TIFs, as the case may be. Some of these postinol too. Sometimes when you take it at that moment, or some people that take contraception for like 2-3 years, they might not really have that sexual urge compared to why they were not on those contraceptions. I don't know if you get.
Okay.
Another thing is this particular drug that is used for prostate, finasteride,
Okay. For men that have
tamsulosin,
prostate issues.
prostate issues. Drugs like that can actually decrease sexual urge or even libido. So they are not really much. They are not really much, but those are the key drugs that once you take them, there's that likelihood of you losing some of that sensations. I have the feeling to or want to. Sometimes you might think, but you have to respond to it.
Okay, so that means there's a possibility that somebody might have it in his head. Because I see these things based on what I do. I see men or women come into my DM and say things like, I still like my husband. Maybe I still love my wife, but I know if he just respond. Like, my husband, my wife wants to be with me. I want to, like, deep within me. But I'm noticing my body is not responding. My body is not functioning. So does that mean that some of these drugs can lead to such an effect?
Definitely, sure. Let's look at these drugs like, let's say, antidepressants.
Okay.
How does it work? Basically, for someone to be depressed, we look at some chemical messengers in the body. We have likes of dopamine, we have serotonin. Let me just start with those two.
Okay.
We have others, but those ones that are key players, serotonin and dopamine. Dopamine is generally known as pleasure hormone. I want to have sex. Once someone says that I want to have sex, I am horny. Check the dopamine level.
Okay.
It's very high. But how does antidepressant work? Especially the ones that we call, there's this class of antidepressant we call selective serotonin reuptake inhibitors. That simply shows that serotonin level is low.
Okay.
For you to be depressed, because mood is controlled by serotonin.
Okay.
For you to be depressed simply shows that
your
serotonin level has reduced. You get? And we have those drugs that helps. Those drugs that actually help. Okay, your serotonin level is low. That's why you are depressed. Maybe you lost someone. Maybe you ate breakfast. Maybe I know you've not experienced
breakfast. They reduce serotonin. Oh God, no
definitely
wonder.
Because you'll be depressed and it comes down.
Okay.
Especially in women that have lots of mood swings, they can. What is the problem? So we have drugs that can help restore that serotonin, and we have a problem as well because everything has to be in moderation. Serotonin can affect dopamine. As I said earlier on, dopamine is known as the sex hormone. I want to have sex. The pleasure hormone. It gives you that excitement. That's what dopamine does. But serotonin, once it is high, inhibits dopamine.
Okay.
You get? You might feel like, I want to have this sex, but that drive is not there because the drug you took, especially for those who are on those drugs, they may not know. At first, because sometimes you are looking at benefits outweighing the risks. I am depressed. I need to come back.
Okay, so you're being given drugs.
You are being given drugs. But you might just feel that, I'm no more having that urge. You might have the sensation because when looking at the pathways, the brain is there, as I said earlier on, hormones, nerves. Dopamine comes in terms of the nerves because they are the ones that will pass those
Okay, the
signals.
neurotransmitters.
The neurotransmitters. Thank you very much. Neurotransmitters. Dopamine is one of them. And serotonin, what it does is to ensure that you are good. But once it is higher than dopamine, that's where the problem lies, because dopamine is what controls libido. It's what controls arousal. And it's also what controls orgasm. You need it. It is center. You get? So when you take antidepressants, you might not actually have, you might think of it because the brain will tell you, why not? It's been a while. You have your husband. Once you see your husband, the brain will tell you, send a signal, how far? You have to do this. But what if the drug you took, that antidepressant, it will not allow you because dopamine has been suppressed.
Okay.
So that's number one. Then number two, we look at drugs like beta blockers. Beta blockers, what they do is they help to reduce BP, high blood pressure.
Okay.
That's what they do. And basically by, because for us to have, let's say, high BP, it simply shows that there is vascular resistance. Let's say this is how your nerve is or your blood vessels are. It's being constricted because when you look at beta blockers, adrenaline, noradrenaline, those are what are really responsible for, let's say, peripheral resistance. So when you give drugs like, let's say, propranolol, which is a beta blocker, what it does is to help dilate the blood vessels. Okay. You might say, okay, let me reduce this BP because of my high blood pressure. It will do that. But what beta blockers do is that they reduce the blood flow that gets to the penile region, the genitals. Well, we understand that for there to be erection,
you need to have enough blood flow.
Blood flow has to be, it has to be very fast. It has to be going there, just like, balloon. For you to
have a bigger balloon, you need to pump in more air.
It has to go in. But what if you lower this and it in turn lowers the blood flow to the penis? So that is number one. Another thing that beta blockers do that makes it even worse is that they inhibit this particular messenger we call nitric oxide.
Okay.
What nitric oxide does is that it helps. It's actually found within that region to help ensure that there is enough blood flow. But beta blockers, they also inhibit that nitric oxide. I don't know if you understand.
Yeah.
They do two things. They inhibit adrenaline that causes constriction, thereby
allowing the blood vessels
to be open. Then we also look at the nitric oxide that helps naturally to dilate the blood vessel that leads to the penis, even the genital, because there has to be lubrication.
Yeah, even with women.
Yes, with women, there has to be lubrication. Blood flow, yes, for lubrication. But if there is absence of that nitric oxide, that's where the problem lies. So that is why some drugs we take, some people do come to the pharmacy and say, "Fam, please, whatever you are giving me,
don't do anything that will affect
Hey, don't. I'm like, no problem, sir. There are a lot of anti-diabetes.
Don't do something that will affect my Odogu silence.
There are a lot of anti-hypertensive that basically they are safe. They won't affect, but beta blockers and even thiazides, as I said earlier on, thiazide diuretics, likes of hydrochlorothiazide, I may not want to mention, but what they do is that they reduce electrolytes and sensations. You need electrolyte because sodium and water is being lost when you take diuretics like that hydrochlorothiazide.
Yeah, because you have to remove water from your body.
Because salt is always responsible for increasing BP. The aim is to reduce blood pressure. Most of these things are side effects of these drugs. You get like that thiazide. So once there is excessive removal of sodium, sometimes magnesium, sometimes potassium from the body, what happens is that there will be reduced neural sensation because they play very vital role in the nerves. So we might not actually have the signal that I have to, you get.
Okay.
So these are pathways that when you look at them holistically, you know that some of these drugs.
So I'm still looking at, now that could be understandable because like basically that's like a medication and we know how much the heart affects, the functioning of the reproductive system, especially in men. But you mentioned hormones, like hormonal contraceptive, if I could say so.
Yeah.
Because I want to know how it actually really works when it comes to hormonal contraceptive. How then does it inhibit or increase the sexual function? What I'm saying is that we've noticed that if somebody, for example, let's use the common emergency contraceptive, Postino. When people start to abuse Postino, Or when they start to use, they're more likely going to use. No, seriously. It seems, I don't know, maybe it's because it gives them a false sense of safety. So does it inhibit their function? Does it decrease the sexual function?
When you are taking hormonal contraceptives, what you want to do is to prevent ovulation.
Okay.
That's number one. Because once there is that intercourse,
And
you know
there's
that
ovulation.
last there's ovulation. So what you do is to stop it. And number two, also increase, let's say, the the vaginal fluid, make it thicker so that
The sperm
sperm
cannot
can't
penetrate.
penetrate. You understand? But what happens is that this globulin, we call the sex hormonal globulin. What that particular thing does is that once you take hormonal contraceptive, it is initiated and it inhibits hormone we call testosterone. I know that there are a lot of people that say, okay, testosterone is a male hormone.
So how does it
Please,
affect woman?
testosterone is human hormone.
Okay.
Let me just use it. I hope you know that there are some guys that they speak like females. They have
Yeah.
this feminine voice.
Okay.
When you look at them, there's a trace of estrogen in them.
Okay.
So basically, estrogen can be found in male. Likewise, testosterone in female. I don't know if you get.
Yeah.
It's just that testosterone is more expressed in male than in female. Likewise, estrogen, which is more expressed in female than in male. But testosterone is the key player in most of this sexual arousal stuff. Anything that has to be sensations, libido, orgasm, testosterone has to come in, both in male and in female. So what that globulin does is to inhibit testosterone.
Okay.
As I said, testosterone is very important. It's sex hormone that helps in libido, it helps in arousal and even orgasm. So once this globulin, because the contraceptive have been taken, that globulin has been initiated, there's actually a reduction in testosterone. So with that, you should know the effect.
Okay.
There will be reduced libido, reduced urge for sex. There might be dryness, a lot of things, vaginal dryness, because even discomfort at some point. So the person might not even be willing to, especially if taken over time.
Okay, for people that are long-term users of
long-term
contraceptives.
users of contraceptives.
All right. So please, if you're out there and you're a long-term user of contraceptive, for whatever reason, you should realize that this could be part of the side effect that you're going to experience. If you're just joining us, this is the Intimate Matters podcast, and today we're looking at how medication and hormones affect our sexual and reproductive health. I'm sure that you've already subscribed to this channel. If you've not, please subscribe. Click the subscribe button and also click the bell notification button so that you'll be notified every time that we post a new video. You can follow us across all our social media platforms, on Facebook, on Instagram, on TikTok. And when you go to our YouTube description, you'll see a link to our WhatsApp channel where you can join, and we'll be glad to interact with you. And don't just watch this video alone. Do well to share it so that others can also learn about it. So while we're still yet on the effect of this medication and hormones, are they forever? So if I'm already starting to suffer the effects, are this effect forever? Are they temporary, or can they be reversed, or that's something that just once it don't happen, to it don't happen?
Not at all. They are mostly reversible.
Okay.
Except for some who, there are some prescriptions that they come for a lifetime. You have to just take them, especially drugs for benign prostatic apoplexia. Yes.
Okay.
The BPH, like finasteride. You have to take it so that it will help curtail or prevent prostate cancer from emanating. But drugs like hormonal contraceptives, antidepressants, antipsychotics, it's, the way the body does its stuff is that once you take these drugs, at first, the body will react. Yes. The side effects will be very profound and pronounced at first glance, because you are just taking the drug at first. But over time, the body will try to adapt. I don't even understand.
Yeah.
That is how life is. Maybe at some point, just like our Nigeria, there are times that at first, things are very hard, but before you realize, everyone will adapt. That is how the body works. When you take some of these antidepressants, at first you can start losing those signs, those symptoms of, those sensations of having sex. But at some point, the body will tell you, hello, you've overstayed your welcome. So it's time for me to take everything to normalcy. So, but it might take up to a month, sometimes 2 months, sometimes 3 months before your body will regulate everything, will balance up everything. So some of these drugs that we take, they are basically reversible. Some, once you stop them, everything ends. But if you are placed for, okay, let's say you have to take it for 6 months, maybe getting to 3 months, you might start getting reduced effects, lesser effects of, in terms of losing libido and the rest.
Okay.
So they are basically reversible.
Okay, so now what since there are things that happen, so what are the certain things we could look out for in terms of symptoms, if I should call them that I might not be learned in the aspect of medicine to know like the chemical constituents of these drugs, but then what are the symptoms that I could possibly look out for? So I noticed that I'm taking these drugs for whatever thing that I'm being treated for. What are the things I should look out for that when I see them I could be like, it's affecting my sexual health? What are the things to look out for? That could be symptoms, signs to point to the fact that a drug you're taking is affecting your sexual health.
Okay, the most important thing is that urge.
When the urge is
You
gone
should have it.
or reduced.
No, when the urge reduces, because at this point we are looking at reduction, to be very honest, because most of these drugs, what they do is that they reduce your libido. They start from reducing the libido. You may not even be thinking about sex. And it's a problem, you know that, right? It's a problem. Because this is what we have to always experience as far as you are a living being. Especially in some stages, maybe if you are newly married, it is very, very pertinent that you should always be aroused.
Yeah,
you should always have it.
Yeah.
So if you were initially sexually active, and after taking a particular drug, and you realize that you don't think about this, you can even look at someone naked, you are not moved. That is the number one sign. The second one is that maybe within the genital, you feel this numbness. You are nothing is moving. You are not feeling anything. For the females, there will be dryness. At least to some extent, it should be that.
There should be discharges.
Yes.
Yeah.
But you are feeling dryness all through. That's the problem. That's a sign that you have to look, maybe make either a flashback to what you took or what might actually be responsible for it, because drugs, as I said, they have a very key role to play in this. Or your hormones. What is wrong with my hormone? Or am I having this sensation, but I'm not pushed? You get? Because hormones also play a very vital role, as I said earlier on. You might have the sensation because the brain is number one thing. It will always give you that signal. Okay, you can have a desire, but the hormone is what will take you there. Just like we have a car. Let me use that analogy. You have a car, yes. The driver of that car is the brain. Why the fuel that will help that car to move is the hormones.
Okay, so that means the driver might think of moving, but when there is no fuel, the car is not
you might
going
be very
anywhere.
excited to what is happening? I cannot move.
So I want to travel now and I want to get somewhere outside the city, but there's no fuel. I noticed that in as much as I'm inside the car and I want to move, there is no fuel. So it means that the desire comes.
Yes,
but then the hormones is not backing you up to for your dugu silencer to.
Thank you very much. So at that point you have to no, there's a problem somewhere.
Okay.
There's a problem somewhere. So those are things you have to look out for. Another thing that is also very, very important I would like us to is maybe for the females, you are missing your periods kind of, I was actually menstruating here, maybe these dates, the following week or the following month that I was meant to, you are not seeing it, the flow coming as supposed. That is something you also look out for, because your hormones can also be responsible for that.
Okay.
So those signs are basically what I feel are very common.
Okay.
As a man, if there is numbness, you are not feeling anything. For the woman, if there is dryness, you are not having the urge, or there is this emotional detachment. I hope I had mentioned emotion.
Yeah, you have mentioned emotion when you talked about the 5 key components.
Yes,
when it
emotion
comes to
also comes in because, let's use rape as a case study or as an instance. If someone is to be raped, the person won't be there. Nothing will move the person.
Okay.
The person will be as dry as, I don't know how it is, though, but because, I've not been there, I don't really understand, but maybe in term, like, from what my study I've made, emotions have to be attached.
For the body to
Positive
respond, emotion has to be attached.
has to be there.
Okay.
Because you need to trust the person to give yourself out. Even the brain won't be moved. If the brain is seeing traits, why will I get there if I'm seeing traits? So during rape, I don't think people actually experience that arousal or the
Yeah.
libido because they are forced.
Yeah, I think also that's why they come down with certain side effects, like maybe bleeding after.
Thank you, because it's
bleeding
always
after
very
the whole
dry.
process.
Yes, at that point it's always very dry because the vagina has to be wet for it to be smooth intercourse. So once there is bleeding, you know that there's a problem somewhere, maybe dryness. And if you are to rape someone, I know those people, they are already aroused. You must do it at all cost.
Yeah.
So that may lead to a lot of bleeding and the rest.
Okay, so let's look at hormonal, the aspect of hormones, because we're seeing a lot of hormonal imbalances. I'm sure you've seen your own share of it, especially in the clinical space. People used to ask me and be like, when you say hormonal imbalance, which hormone? So what are like the major hormones that are implicated in these imbalances that, because I know we have various hormones. So what are the ones that are implicated in these imbalances that affect the sexual and reproductive system?
Okay. First and very important one is for the male, we just have one, which we hold very dear to ourselves. That's the testosterone, which in women should also be there.
Okay, but at least in a lesser amount.
Yeah, in a lesser amount, but you still need it for that arousal,
Okay.
the desire. Then for the female, estrogen has to be there because estrogen helps in terms of lubrication. It helps to give you comfort, to make you calm, to give you that pleasure as well. Because absence of estrogen, or when it is reduced, there's always a problem. That dryness will be there, that discomfort will be there. Another very important hormone is the thyroid hormones. Very, very important as well. Thyroid hormone. Talk about the thyroxine, even the triiodothyronine. That one is also very, very important. And what does what do the thyroid hormones do? First, we look at energy production. In terms of metabolism, thyroid hormone is there to give you the energy to, carry out the whole exercise, because you need energy, my guy.
You need energy. If skin no full body.
So when thyroid hormone is tampered with, the energy will not be there.
Okay.
So apart from the blood flow, you have the blood flow. You need something that will help you sustain the intercourse. Okay. So thyroid hormone also play a very vital role. Another thing that is also very important, that is also very implicated is though that one is actually for maybe pregnancy, but it's also important is the progesterone. Yes, it can also be very, 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 shall I say, essential in that particular aspect. So we have estrogen, testosterone, even prolactin. Yes.
Okay.
Because prolactin, though sometimes when it is very high, it is for breast, basically.
Yeah, for production of breast milk.
Either for ejection, breast ejection, breast production, and the rest. Prolactin is also important because when it is high, it affects dopamine. So dopamine is fighting very hard with prolactin. So once there is increased level of prolactin, because there are people who have that condition. Yes, I've treated so many people. They come, fam, I'm not pregnant.
Yeah, but galactorrhea, but they're having discharges from their breast.
With that, there won't be any sexual urge, brotherly. There won't be. Because once there is high prolactin in the blood, it inhibits dopamine that helps in libido, arousal, and even orgasm. So prolactin is there, testosterone is there, estrogen is there, thyroid hormones, and maybe a little of progesterone.
Okay, so while we've just been able to discover a couple of things that are helping, so let's try and see what are the way out for all of those people. So like you've said something, because I once asked if it's reversible, you say they are, but then you also mentioned people that are on long-term or sometimes lifetime medication for whatever condition. Do you think that possibility of either adjusting their dosage or looking for an optional remedy When I say remedy, you talked about, for example, you talked about like high blood pressure. We know there are so many facets of therapy that can be given. All of them act differently. Can this also help? Reduction of dosage or maybe reducing the timing in between these dosages? Can it help to manage this condition?
Definitely, definitely. The thing is that we do advise people to report any side effects, because when looking at drugs, it's what we call genetics. And in terms of pharmaceutical science, if we look at pharmacogenetics, we're trying to look at, okay, let's use chloroquine before coming to this. There are some people that if they are injected chloroquine, they'll be dancing, shouting, screaming, scratching their body because of how itchy it is. They react to it. But there are those who will take this and nothing happens.
Okay.
That tells you that the way you are wired through your gene or genetic makeup is different from the way I am at that particular moment, that instance. So some of these side effects might not be pronounced in everybody. You might not see it in everyone. I don't even understand.
Yeah.
Yes. But so we do advise our clients, our patients, as the case may be, once you experience any of these symptoms or signs, please report back to us. We can do two things: reduce the dose or give you an alternative medication.
Okay.
With a lesser side effect of that. So it can actually be cured.
Okay, so what advice would you give to someone who's like currently struggling? So here am I, I'm struggling with hormonal imbalance currently as I am, or maybe I'm undergoing a particular treatment regimen because of this is affecting my sexual health. What kind of advice would you give to such a person?
The first and only advice I would give: please report all cases, all inconveniences to your either professional or provider. Your pharmacist is always there. Your doctor is always there. Just go to them. However you feel, we always have a way out for you. It's not a death sentence, trust me. It's not a death sentence. We can always replace everything back.
All right. Thank you so much, pharmacist Elijah Itefia, for coming on the Intimate Matters podcast. And we've been discussing medication, discussing hormones, and also how it plays and affects our sexual and reproductive health. So just before we go, fam, of everything we've said, if there's like one thing you would want the listener, just take this one thing home. If you cannot take the every other thing we've said, what would that be?
Okay, please. There are lots of myths that some of these things I'm experiencing, they are due to one spiritual stuff like that, or one maybe because of my man has an ex, or his ex, or my man is still going back to his ex, or my wife is still going back to her ex, as the case may be. Please just get rid of it. Once you experience a decline in your sexual life, please don't assume. Just go to your pharmacist, go to your doctor and report. Don't say that, maybe I know you were outside with someone. I knew that, because that has always been the issue. We have lots of cases. We've listened to so many things. So my advice is that in case you experience any of this, because we are talking about sex, this particular aspect, if you experience a decline, or you are even having, let's say, excessive urge, it might also be let's say, a disadvantage. So please report them to your doctor or pharmacist, because it is also treatable.
All right. So, fam, Elijah Itefia says, if your tata is not tataing or is over tataing, please do well to always go back to your healthcare provider and place your complaint right before them. Oftentimes, especially in these our climate, we are used to, attributing everything to, the spiritual things, village people, and I don't suffer. I wish we were not village people, but we give them to the village people and the rest of them. But most of these things are medical condition, and there are things that could be handled. Thank you so much once again,
It's a pleasure,
Elijah, for coming on the Intimate Matters podcast. And we want to say thank you to you, because you're the reason we're here. We're here to share this information, this knowledge with you on the Intimate Matters podcast. We care about your most intimate matters. That's why we're here talking about your sexual and reproductive health. And do well to follow us across all our social media platforms on YouTube, Facebook, Instagram, TikTok. And we'll be glad to hear from you if you join our WhatsApp channel and communicate with us. And just to say this, that if you're around the city of Uyo, a few months from now, we'll be putting together an open house, a health fora. Come sit with us. You can also join us virtually. Come learn with us. We want to learn with you. We want to hear from you. My name is Nosa Kwawokman, your host on the Intimate Matters podcast. And until we come your way next time, it's bye for now.